Hello, everyone. Good morning, good afternoon, good evening. Welcome, ladies, gentlemen, guys, gals, and non-binary pals. I'm Monique Springer, Project Officer with UWIHARP, and I'm joined today with Ms. Latoya Lane from Pillow Talk Caribbean, if you remember her from our spicy talk on sexual pleasure. Today, she will be providing some technical support for us, and I'm really grateful to have her on board with us today. A very special welcome to our students, staff members, colleagues with the National HIV/AIDS Commission, off-campus partners, repeat visitors, and to our new guests. UWIHARP is the HIV sexual health unit at UWI, and we seek to positively influence the sexual and reproductive health and wellness of the university population and the wider Caribbean society. Our primary focus is the development of sexual health literacy among the community through programs such as our digital dialogues. These are sexual health conversations and will be held during this semester. They include the S-Files discussion series on a wide range of topics, which we concluded a couple of weeks ago with Latoya. And now we have the Shock series, which will focus on sexual health issues among our vulnerable Caribbean populations during COVID-19. You can look out for the flyers on our social media platforms, which include Facebook, Instagram, the UWI app, and through student UWI emails from the Office of Student Services. There are a few participation notices. All mics are muted and videos are turned off. Q&A will take place after the presentation and the mics will be unmuted. We ask you to post your questions or comments during the presentation in the chat pod located at the bottom of the screen. We aim to address as many as possible at the end of the presentation. Alternatively, you can message either me or Latoya directly if you prefer. For those questions we couldn't get to, please email them to uwiharp@cavehill.uwi.edu before the end of the day, and we will address them shortly afterwards. The sessions will be recorded, and the recordings will be posted afterwards on our social media platforms, including our YouTube channel, UWIHARP Cave Hill. And these will be done without sensitive personal discussions to protect participants' confidentiality. Please note that we cannot guarantee confidentiality in this public forum among participants, so be cautious about what personal information you disclose about yourself and others. It is safer to talk in general terms. Please also complete the evaluation form that will be sent to you after the session, and you can suggest topics that you're interested in for us to facilitate. And today's topic, we will be looking at intersecting pandemics, experiences of marginalized populations during COVID-19. And by intersecting pandemics, I'm referring to the pre-existing stigma and discrimination before COVID meshed and colliding with COVID. And today we have two fabulous special guests. We have Mr. Michael Rapley, who is the founder and current chair and project manager of Equals, an LGBTQ plus focused organization in Barbados. Identified as a gay man himself, he jumped at the opportunity to try and make a positive impact on the community by working part-time for the Caribbean HIV/AIDS Alliance, facilitating weekly support groups and creating safe spaces for them. This led to the birth of Equals, whose main focus is to ensure that the LGBTQ plus community have access to services which they would not normally have due to fear of stigma and discrimination and other human rights infringements that prevent the access they need. We also have Ms. Gina Emmanuel, and since 2004, she has been actively involved in several capacities with various NGOs locally, regionally, and internationally in the field of HIV and AIDS. In addition, she is the founder and president of Community Education, Empowerment and Development, SEED, an inner city non-governmental organization working with marginalized groups, including persons from the LGBTQ plus communities. Presently, Dedrina is the project lead and peer navigator of the SEED EPIC project, a project with special focus on men's health, working with at-risk men. Gina holds a Bachelor of Science degree in social work from the University of the West Indies, Cave Hill campus. And I just wanted to mention very briefly, now that everyone is online with us, some rules for engagement, some of which have been adapted from the HIV 2020 online. UWIHARP's digital dialogues provide a safe space to address a range of sexual health topics using a sex-positive approach. We encourage participants to share their knowledge, experiences, and opinions in a respectful manner. You may disagree with views highlighted today. However, please be respectful of other outlooks, regardless of your religious or moral beliefs. Let us be mindful in the way we discuss sensitive topics. UWIHARP operates on a zero tolerance policy for any kind of abusive, discriminatory, belligerent, or disparaging comments or actions that may cause distress to presenters and or participants. Persons who engage in any undesirable behaviors will be immediately removed from the webinar unannounced. UWIHARP's guiding principle is to first do no harm. And today, I think it's very special for us at UWIHARP for the Shock series, the Sexual Health Online Conversations about COVID. We started the first two sessions with, the first one with the Caribbean Family Planning Associations, and then last week we had UNFPA, United Nations Population Fund. And for the next three sessions from today, we'll be speaking directly with the communities that we are really targeting and we are working with and for. And today is the first one in this series, Stories from the Trenches. And we're holding space and giving voice to key populations to share testimonies of lived experiences. And I wanted to perhaps have some framing thoughts, some of which came from Winnie Byanyima, who's the executive director of UNAIDS, where she looks at COVID as heightening the offenses and assaults on vulnerable and marginalized populations facing pre-existing stigma and discrimination, which include persons living with HIV, people from gender and sexual minorities, sex workers, and migrants, in particular undocumented migrants. She notes that stigma and discrimination exposes people to violence, harassment, and isolation, stops people from accessing health services, and prevents public health measures from effectively controlling pandemics. So in other words, COVID-19, in her view, and from the view of those of us working in the field, exacerbates the pre-existing inequalities and perpetuates stigma. But is that the case here in Barbados? And so we're going to hear from both Michael and Adrina today about their experiences with their key pops that they're working with and their communities. So I would like to invite Michael now to share with us some of his experiences. So Michael, take it away, presto.
Thanks very much, Monique, and thanks for having me, and good afternoon to everyone here. Before I start, I'll just give a brief about what who Equals is and what we do. So as Monique would have mentioned, Equals is an LGBTQI organization. Our focus is really on ensuring access to services by the LGBTQ plus community, especially in cases where they don't access it due to stigma and discrimination or perceived stigma and discrimination. So this can range from sexual health to general health to mental health to social services. And so what we've managed to do through the linkages and EPIC program is actually have our own community site, our safe space, where we actually provide some of these services ourselves. So throughout the time under the funding, we have done HIV and STI testing, which includes rapid testing, psychosocial support, We were one of the first community sites in the Caribbean to actually offer PrEP. What else have we done? We in the last program period, we actually offered antiretroviral treatment on our site for that period for those that we might diagnose positive throughout our testing period. We've had a legal support clinic as well for anyone who has queries regarding legal actions that can be taken. And we've also had an emergency housing grant for a short period of time. And that was quite an experience to have because we realized that more resources than we thought were really needed to provide that service. Um, and so, that sort of ties in a bit of what we do today. But currently, we're set up. We're in the Wildy area, and we're still providing our testing services and prep services. And you can check us out on equalsbarbados.com. So that's basically equals in a nutshell. We do a lot more work. We do sensitization workshops to sensitize uh, service providers, um, so that we don't have to provide all these services ourselves. We can also refer persons to services that we have sensitized ourselves and know that the community can access them stigma free. So we do a bit of that as well. So yeah. But COVID-19 has happened and it's put a spoke in a lot of our wheels. Everyone's plans have been messed up for COVID-19, and that includes obviously members of the LGBT community. And so, as y'all might remember, we went in lockdown from I think March 28th or so for about a month and a week or something. So, and then we started to open up early May, or 2 months even. Um, so what happened then, as we all know, businesses shut down, tourism stopped coming in, persons were laid off, persons were on reduced hours. And so this really applied a lot to the LGBT community as well. Equals actually put on a survey supported by the UNDP project, Being LGBTI in the Caribbean. And this survey was done in Barbados, Guyana, um, Grenada, and St. Lucia with fellow organizations in those countries. And some of the things that we found coming out of that survey was that 36% of Barbados persons who replied to the survey had reported that they actually lost their jobs. And then another 25% reported that they were either temporarily laid off or on reduced hours. And this survey was actually done in May 20th to May 31st. That was the period that it was done. So it's still fairly new within the pandemic. So a lot of those persons who reported temporary layoffs may have had extended layoffs as well. That's something else to consider when you think about that. So that is about nearly 60 or so percent of persons reporting from the community that they've lost their jobs or temporarily laid off or had reduced working hours. And then only 10.8% of respondents said that they had more than 2 months savings. So that's not a lot of persons at all. And so, we realized that, persons within the community who answered the survey don't really have the opportunity to have savings. In addition, in regards to mental health now and how that affected the community, using the patient health questionnaire, which is a very basic scan of screening for mental health. 45% screened positive for anxiety and 43% scanned positive for depression. So it's not surprising to hear that when we're talking about the needs of the community that they reported, 25.5% said that they needed someone to talk to, and then another 24% said that they needed emotional stress support, emotional or stress support systems, right? Other needs that were reported was 16% needed help with food and water, and 14% needed help with rent or place to stay, or place to live. So the other things to consider. And then another need was 11.6% said that they needed help with access to medication, and that correlates basically with the number of persons who indicated that they were HIV positive within the survey, which was 11.9%. So basically, the majority of those persons indicated that they needed help accessing their medication within that period of shutdown. What Equals was able to actually do in terms of helping these situations, where we were actually awarded an emergency grant from Outright International. And so that grant was put towards care packages and helping with rent. And so we collaborated with She on this initiative, and that helped us, extend our reach into the community, making sure that as many persons within the community who needed these items got them. And we were actually able to create 60 care packages from that grant. And that was also with a bit of help from other donations as well. 40 of those 60 came directly off of the funding from the grant. And then donations added with the additional leftover items from the grant created the other 20. And we also helped about 7 persons with rent. I think we covered about 14 weeks rent between those 7 persons. This support, however, only lasted through May to June, but we basically had used up the grant by the middle of June anyways. So Equals obviously then had to close during the shutdown, just like everywhere else. But we were given the go-ahead by the ministry to resume our services the first week of May. I think May 7th was the first time back in that we offered our testing services. And actually between the remainder of the EPIC project, we had 65 persons accessing the testing services. So it's evident that that was still a service that persons were happy that returned. We also, our psychosocial counseling, which was also part of that program, actually never stopped. It just went online. Even though it wasn't really that accessed. And I think that was mainly due to the fact that a lot of members of the community do not have a private space within the homes that they can actually utilize to have these personal conversations with a counselor with. But after the shutdown, and we continued some online, but then we also had some here, the uptake picked up. And so, yeah, but the EPIC program ended at the end of July, and we were able to continue what we're doing with some funds, but the psychosocial counseling had to stop. But we're actually just started it back with a collaboration from the Family Planning Association and UWI. And we started that back actually beginning of this month, which is now within the first week, it was almost fully booked, and now we're already fully booked up for that. So it's definitely evident that it's a service that is required. I'm surprised there are not more grants for calls to assist in mental health, especially since everyone is saying that the next pandemic is going to be a mental health pandemic. So it's curious to me why there are not more calls for grants going out to prevent said mental health pandemic, but it's definitely something that is out there. It was an important service needed for the community before COVID, because they were dealing with stigma and discrimination and the effects of that. But even more so now that the effects of COVID on top of all that are coming into play. And so we did continue our engagement with the community during the lockdown as well. We continued our Friday night lines online via Zoom. So those continue to keep the community engaged, and so that they feel like they still have a safe space to come to. But persons are still struggling now. Employment, a lot of the community as I reported, had lost their jobs, and this is because a lot of the community were working in the hospitality and tourism industry, which we know has taken the heaviest hit from COVID-19. And even though some hotels, well, they were basically forced to open up, they're I know that some are doing a second set of layoffs again. So, some have managed to go back to work and now they're laid off again. And this obviously has a lot of implications financially, mentally, emotionally. So the community has really been negatively impacted, I think, a bit disproportionately than the general public. Fortunately, there's been some good news, I guess, for the community, not necessarily in regards to COVID-19, but in regards to their human rights in general, with the passing of the Employment Discrimination Protection of Discrimination Act that was passed a couple months ago, which speaks directly to protection of persons from discrimination based on their sexual orientation. Unfortunately, it leaves out gender identity and gender expression, but I've been told that there's more work being done in terms of anti-discrimination legislation that will also cover those characteristics of individuals. So we're looking forward to that. And then there's the talk of recognition of same-sex civil unions. That's there as well. And I guess we have the 12-month work stamp to thank for that, because I know that there was a hullabaloo, um, some articles, international articles, talking about how, you're having this stamp, but you are excluding gay persons because um, you do not acknowledge a same-sex, and then persons have to apply as individuals within that family unit, as opposed to being able to apply as a family unit, which are the options for the 12-month stamp. So that sort of, I guess, gave the administration an excuse to try and put some inclusive legislation in play in terms of acknowledging civil unions. Um, but then there's going to be a lot of pushback, as we see with the churches marching every Saturday against even the civil unions, even though gay marriage itself is supposedly going to a referendum. And why I'm bringing this up now is because it has an effect, because if the community has more rights coming out of COVID-19, they stand a better chance to navigate society. So it's a good time, but I think that we as organizations and individuals have to also take a stand for the community and ensure that their rights are indeed acknowledged and defended. So the legislation can come into place, but we know that that does not necessarily mean that attitudes will change overnight. So there's still work to be done in that regard. So I think that's basically where we stand. I think the community still is suffering from the effects of COVID-19. I think a lot of us are, not just the LGBT community, but I think a lot of persons in general are. But yeah, I just hope that I've helped outline some of the real issues that the community have faced during this time. So thank you very much.
You're welcome. And you're at your 5-minute mark.
Thanks, Michael. And Mr. Drina, I think you can unmute yourself.
Good afternoon, everyone. Hi, just a correction quick. I know Monique would have said in the bio, I look back at it and said the peer lead Epic has, as Michael said, come to an end. So that no longer is running. I forget to edit the bio. Anyhow, I'm the Gina Emmanuel, the president of Community Education, Empowerment and Development. As Monique said, we're in a city organization working with marginalized groups in Barbados. And the LGBT community happens to be one of the marginalized groups we work with in Barbados. How we work with these groups, actually, we have a model which we call a biopsychosocial model. So we deal with education, and the education could look at skills building, where we would have done cake and pastry, other skills classes like cooking on a budget, basic cookery, and the list goes on down to small space gardening we would have tried. The educational aspect we would have done from the functional literacy and functional numeracy and computer fundamentals, as well as CSC Maths and English. We also, from the psychosocial aspect, we do psychosocial care for all marginalized groups under different grants, because we have a grant from the commission, we had one from the linkages project before the EPIC project. And we also have monies to do with the Maria Holder Memorial Trust, which allow us to work with the whole sector marginalized group and not be honed in only to the LGBT community. However, from the biological aspect, we also run a clinic. Well, we also used to run a clinic. That is before the COVID-19. It came to end around that time. And the clinic was our Saturday community evening clinic. And the clinic will do such things as general practice, looking at things like NCDs, diabetes, blood sugar, and also we will have special focus on HIV and STIs and other areas, because some of the doctors work within the polyclinic system. So what couldn't be done at the clinic, they will refer them at the clinic there are to access other services. So that is, in a nutshell, what we would have done. These projects would have come to an end, but however, as I was telling Monique and them, we recognize since COVID-19 had such a great effect on the world. Let's start with the world first, and then we hone in on the marginalized group, but also the LGBT community, that we decided that we would like to go on with outreach, that is to go there, interact with persons from the community, and also psychosocial support was going on. We got permission from both the National HIV/AIDS Commission and the Maria Holder Memorial Trust to continue with these interventions, so we could continue to work with the community, especially in these trying times. As we go on to the presentation, in terms of how the experience of the community, and we did not do any survey or anything like that. So what I'll talk about is mainly interactions and observations of persons within the community. So let me go in from a social standpoint. It was a new norm for everybody. New norm, new processes, laws that had to guide them and govern them. And one part of the community that I mainly work with, that is sex worker males and some of their partners who happen to be their clients and such like. And one of the problems you'll find that navigating spaces in this new era, because curfew then came about and you had to be in by certain times. So when I would talk to some of them, they would say, oh, I need condoms, I need lubricants, I need these things. But remember, it was a new norm. You had to come outside when it was your letter to shop and all these kind of things. So we had to make some arrangements to meet with them, especially when the day of their letter, that they could actually get the whatever they were requesting from me at that point in time. But also too, because I know of some of their clients who happen to be bisexual down low men, it is now operating on a space now that certain things had to be done in the day. And when I say certain things, like purchasing sex, you understand me, intimacy, whatever they want to do. And it brought to light, some things that they were very concerned of, like people seeing me going at this person's house, if we go someplace. These were some of the constant fears people were talking about. Also, we recognize this was a time where you had to stay at home. So staying at home was a period of confinement, and you're confined in a household where normally where they could have, escape and go someplace else, a friend house, somewhere else and go. But due to their sexuality, as we will know, I'm not saying every person, but some persons, you will have that kind of conflict within the home because this is a place you have to be. And this is what the law had dictated, that you had to stay at home, not be on the road. And there's when you recognize some conflict rise within families and such like. So, and even conflict rise within the neighborhood where you live, because now you have to face this where you cannot run, you can't go anywhere. You have to face what is going on in the community. So in terms of that, for those who were living alone, it lead to some feelings of isolation, because for the ones living alone, you have to be alone now. Nobody can't come to your home and visit you and such like. And for those who are living with families, it bring out manifesting different types of conflict, whether it be sibling rivalry, whether it be a stepfather who doesn't like the gay son. All these were things when it interact with people. So it brought about that. Also, in terms of Michael would have spoken about unemployment. Um, for some persons, you talk about unemployment. I guess persons look at it because it was not stigmatizing only LGBT community where they're lost in their jobs, but it was everybody was lost in their job in that time when it looked at the tourism industry. And not only the tourism industry, but places that were not essential services. So if you were not essential services, like say you were working in construction or such like, it had that impact on you too. So I guess there were some people who would have been angry, but not angry because they think they were stigmatized um, and they lost their job. But however, this is a new norm, and some of them recognize it as everybody. Um, Also within that, I would have spoke about outreach services, but outreach services also lend to persons living with HIV. And I will say that persons living with HIV, then it was like, what assistance could we give in terms of getting information, because a lot of people was asking for information, how COVID-19, I'll go on to the biological effects just now, but how COVID-19 and HIV, and just send me a link, send me information, and we try to do that. And what I'm saying is, in terms of that, sometimes when you're actually having a conversation, a person having a medication picked up and such like, I think it was even because of the new norms and the laws and the processes, even to go and collect medication, it had to be a determination. If I go to the grocery store or if I go to get my medication. Now, when I go to get my medication, there are so many people there with the same letter with me. It brought about some level of frustration and the thing with the mask and such like. Now with social assistance, SEED and its board recognize that we not only represent the LGBT community, we represent a whole cross-section of marginalized groups. And we wanted to assist in whatever way we can. So we recognize that everybody was doing something, but we also did not get the right to go there because we never had like a badge or anything like that. We weren't seen as an essential service. So within our work, what we did is try to partner with the National HIV/AIDS Food Bank, and we recognize that a good set of our marginalized groups go there. So when it was our letter to shop, SEED board put forward money. The vice president, Joanne Jordan, put forward money. And we made sure we partner with them. And this is a partnership that still continues. Up to last week, we continue to donate to that to make sure that persons still are getting these things. Other people in the community wise, sometimes you know persons in the community that might want a bottle of gas or want something. And if you could afford it, we could afford it. This is how we lend our social assistance. We also partner with those who we know on our WhatsApp chats and different things to lend their assistance, because I remember when it first happened, Stacey had said they were taking assistance in monetary assistance where you could make a donation to their account. They were taking like vegetables and different things. And we try to encourage everybody to go part and help with this, noting that it will help other people in the community, also those who from the LGBT community who might be persons, also a person living with HIV. So that is basically the social aspect of it. Now we're going to move on now to the biological part of it. And I think the fear for most persons, as I said, it was broader because a person could be living with HIV, persons could be living with HIV, but you could also have people who have non-communicable diseases. And the fear of being diabetic and hypertensive, where they said these persons were more vulnerable to, if they caught COVID-19, to have severe implications on their health, even to the point of death. So it's having the conversations with persons that were in that category, and also within the age group, because we say LGBT, but the community is a group of people with various age and such like. Now, moving on to persons living with HIV, I would have mentioned about medication, and some persons would have gone to private clinics and such like. And it was like working with some of the persons who worked at the clinic, the our evening clinic, to help ask them to help us to get persons to access certain services, because we know the new norm was to line up in a line. You had to stay outside, you had to have on a mask and all these different things. So it was like having these negotiation and partnerships with private and the public sector to helping these persons, and I say persons living with HIV, but other people with non-communicable diseases within the community, to access these services, also accessing them on their behalf. So it was at a time, and also information was always important, because all right now, we are still struggling to understand COVID-19, the impact it has on the body and such like, and what can happen. And I find, speaking with persons living with HIV, that was the greatest fear. I already have a compromised immune system. What will this do to me? Could you research information? What information do you know? And sometimes to the point that we get information, try to put it out there, to try to make people as comfortable as possible, or have the conversation with people about, so long as you keep your CD4 up, you remain undetectable. These are the information that we can produce. But I think one of the biggest things that and I will move on to the psychological effects, we did not see how this would have affected persons psychologically, because a great amount of people, even wearing the mask, for me, myself, it brings about a lot of anxiety. Outside is hot, you can't breathe. Sometimes, for me personally, my heart just start racing at times. And sometimes this new norm, just you in a line, and the line is very long. Sometimes they're around in the sun, and you are trying to deal with that. But something that I recognize too, there are people, and if we say living with HIV, or even from the LGBT community, coping mechanisms. And something that I really saw is about drugs and alcohol, and how do we get these things to cope. And many times I read street where there's areas, let me say areas that you can purchase these items. It is like, what I get caught going to purchase these items, but I need this. If I don't have these items, I will not be able to get through my day. So is these coping mechanisms?
To say that you're coming up to your 5-minute mark.
Right. I soon finish. And the dependencies that people have on these things. So alcohol and drugs, you will find sometimes I have a bar too, and sometimes when you look, because they can't get them directly, they come to you, and whatever prices people had charged, they will come and purchase them. But also, Michael mentioned depression too. A lot of people, because of not being able to function within the home and conflicts and all these different things that are happening, this leads to people having depression. But Is it depression that they know they have of, or sometimes they're functioning, but I'm tired and this, I don't want to get out of bed. I don't want to even see the TV with all this going on in the world, people dying and such like, and the fear and the loneliness. But also it was a point of hopelessness. And when we look at the hopelessness, is like people, like this has just landed in our lap. And it's not landing Barbados, that the whole world lap. You cannot travel, you can't visit people, even if a loved one is in the hospital with whatever ailment, you can't even visit them. So it was, at this time, it is very sad because it's still continuing. And I'm saying, but for some persons, I can't say their experience were bad because some of them, it learned them how to, in terms of rethink how they do things, create new ways to do things, to how to maneuver. And also for some persons, it create new skills because of some persons say, well, I baking this bread, I learned how to cook, however it tastes again. So it forced people into a point where they had to, this is about survival. And I'm gonna say end off by saying, for us, the human race, COVID-19 has not been an easy something to deal with. And it's still not easy to deal with because in terms of it, there's a lot of unknown, there's a lot of fear, there's a lot of hopelessness. And I'm saying, but what I recognize works sometimes is actually keeping positive people in your life and such like, and persons that you can count on for that could support you. And I am saying it doesn't have to be financial, it could be otherwise. Saying a kind word, sending a greeting or something that will uplift people because we are all going through this together. What I will say to the LGBT community, it just bring about issues that were there and open them and they manifest itself in other areas. But I must say, for some other people experience, it made them went about to gaining new skills and showing resilience in other ways. That and those are the experiences they can talk about and observations. So thank you.
Great. Thank you so much, Dadrina. See what I told you? Those minutes go very, very quickly. And I really appreciate you and Michael sharing your experiences. Thank you so very much. I do have one question. David Murray is in the house from Canada. Hi, David. Before David, though, I just wanted to say, just hearing from both of you, because I came with this concern of exacerbation of stigma, discrimination, assaults, and so on. But I didn't necessarily hear that coming from you, and I give thanks. I'm saying that yes, it did happen, but not in the way perhaps that I thought that I was going to hear, that I was fearful of, that I was going to hear. So certainly the conflicts of persons from the LGBT communities living in hostile spaces, experiencing those from family members. That certainly came out and is part of the global chapter too that has been going on. But Dadrina mentioned she repeated the new normal, the new norms, the new norms. And from the time I heard about the new norms, I think we need to have a deconstruction of this new norm to see how it's really impacting on us. Is it a given that we should just accept these new norms? I mean, there are all these other different layers of this onion that we need to peel away to see what persons' realities are, these lived experiences. And so, yes, I agree. I think we need to have a better understanding of the situation that people are living in to be able to respond to these new norms. One of the key things that came out in both of them, I think the resilience of the communities and the strong support networks, that groups that you guys are providing. And, I'm really thankful to hear that. But I wanted to ask the one question before I hand over to maybe Latoya, who will field the questions, but David does have one question. Apart from your wonderful organizations providing support, are they tapping into other support groups at the, let's say, with the commission I know, Gina, you mentioned Stacia, and Stacia, you're referring to Stacia Whitaker from the
Yes,
food
please.
bank. Just to let the participants know, from the food bank for those persons who are living with HIV. But I'm wondering if they're also tapping into other governmental support groups, or services that are available, like through the welfare department, and the Ministry of Elder Affairs, even though that might be outside of the age group, but I think that's the ministry responsible for social care. Were there any other supporting mechanisms that provided, alongside, with you, those key critical services that were needed, especially with those that were laid off or had reduced hours?
Actually, I'm on the board of the National HIV AIDS Commission, and that is under the Ministry of Elder Affairs and Social Care.
Social
And
care, yeah.
right, and I remember when Lynn sent out the food bank was running low. That is where we get the idea that this is the way we could help, because at that point in time, with the new norm, and I keep saying the new norm, with the processes, if you then had, I think they were offering you this coded badge to be outside. You can't go to certain domains and such like that, or agencies to offer services. So I'm saying, based on who we could have talked to, we talked to. I was just speaking to our vice president last night, and based on our committee meeting we had yesterday, the Commission for Warriors is doing some different activities. I think one is about for the children with Christmas, and um, donating supplies to some people who don't want to go to the food bank and different things. So there are a lot of things that, and I told her, I'll get, because it was the board meeting, I'll just get what we can do within this domain right now. But I mean, like, everybody was trying to do something, because we recognized they were the younger person. Because what was excited for me is how different agencies come forward to help with those, the poor and those who are vulnerable. So I'm saying, if we could have gotten the opportunity to partner with them, that would have not been a problem. But they were doing good on their own already, and somehow you because of how the new processes had it, that you need to obtain the this badge to be or you need to be deemed as an essential service to work with. And I'm talking early COVID
Yeah.
pandemic Barbados. It restricted us from working with a lot of persons. But
Okay.
now that we have you on, that is more open now, there's a more openness. We are always open to any area that we can help. So I don't see that as a problem. The Maria Holder was doing something, and they helping families. They contact us. I didn't say about that, and we assist them with that part. So it is really being the caveat to assist them where you can. It might not be necessarily the LGBT community, and I would just reiterate that the whole of Barbados was affected. So, and based on SEED, we as marginalized group, we try to help persons. We might not know who might be the L, the G, or B in some families, or the T sometimes, but we help persons, we help human beings.
Okay.
And that is what we set to do. I may know some of them, but in doing it, you have to go and demand it if you're assisting a partner to go as who the partner is and say, we are helping families.
Okay, thanks, Dee. Michael, I wanted to ask you if Equals was also partnering with other governmental organizations for your community members, especially those who were retrenched or had reduced hours. Employment seems to have been one of the major concerning factors for your community members and your group.
No, not really. We
Okay.
didn't really partner with governmental agencies. I mean, as you know, there were a lot of other initiatives going on. So we actually
Yeah.
did work with those
Right.
that were happening.
Okay.
Because we were getting a lot of persons reaching out, and we did indicate that this initiative of ours is specifically for the LGBT.
Yeah. Yeah.
But if you are not and still in need, let me direct you to people who are.
Okay. So referrals.
So that, but even then, when there were gaps in between when we had packages,
Yeah.
we would have done the same thing. So sorry, we don't have any right now. But if you need, let me get this person to help you guys out.
Okay. That's kind of what I meant as well.
We were utilizing at the other channels too.
Yeah. If not necessarily governmental organizations, other organizations outside of the usual suspects that you work with. Okay. Thanks for that. And thank you both for your great responses. David, can you unmute yourself? Let me see. Yes. Take it
Hi.
away, David. How are you?
I'm good. How are you?
We're great. Thank you so
It's
much.
great to see you. Great to see everyone. And greetings from Toronto, where we're cold. And
Yeah, I can see that. Sorry.
Yeah, and we're kind of in the midst of our second wave of COVID here, and
Yeah,
a
I
little
heard.
bit jealous of how well, Barbados and the Caribbean seems to be managing the crisis. But my question, just a quick one for Gina and Michael. One of the things we've noticed in the kind of LGBTQ community here over the last few months as the pandemic's gone on is that everyone's relying on technology a lot more, like, needing to be online for meetings and for socializing, and then even to like make your doctor's appointment now, you have to go online and register. And so some of our people in our community, don't have good internet access or the equipment to do that. So that's been an issue for us. I was just wondering if that kind of increased reliance on technology has like impacted the communities you're working in any way.
Well, for us here, I guess because our restrictions was not for a very long period in terms of that. And there are things you have to go online and make an appointment for. However, health services, like to see a doctor and such, like it is about, at the first point in time, it was about your letter. And I think it was about your surname letter. And it was about getting there and standing up in a line and wait. However, in terms of now where we are at, and before I go any further, just let me commend the government of Barbados for how they handle it, because I think we don't do that a lot to say and recognize where we are at, as not only a Barbados, but as a Caribbean, because from what I see going on, as you say, the second wave, and y'all have now to deal with winter and all this drama, where we don't have to deal with it. Just let me commend the Barbados government for doing their best they can to ensure that its citizens, are taken care of. The other thing that I think that was a problem, and it was in the news, I don't know if you would have seen it, is actually persons living with HIV, which is we have persons who are, well, let me say LGBT within that community too. And there was a point in time where people couldn't know about their CD4 or their viral load because of that. And I think that too also would create fear and anxiety because you don't know that. However, accessing the services remain the same, where you have an appointment and you go to your appointment date, and based on it with medication, what I was told, it was like you had to ration medication, can give somebody like 2 or 3 months in terms of that, because other people had to get, and it was a point in time where, in terms of bringing in shipping and such like, the port and such like. We had all these difficulties. But to answer your question directly, more directly or specifically, yes, there were need to like for entertainment and different things to go on your phone, and for whatever reasons you want to do, for excitement, whatever, or to socialize, that was that. But what we are finding out, the more people are free now to go wherever, but sometimes they're so free to the point in time that they're the behavior, let me be quite honest, when you see it, no mask, no social distancing, the drama, and it gone back like it is normal, and it is could be scary at times. So we are not restricted to that point like how Canada is. However, is my greatest fear we might get back there if we, loosen up and throw our backs to the wind. So I don't know if Michael will come with something different, but for the persons I talked to with, I think the strategy is more a cell phone and get a call. This is within the sex worker community to meet and do what you have to do. We don't have no restrictions what time you have to be in at night, so they can continue to work.
Thank you, Gina. Michael, you want to add to David's question about the use of technology during COVID? You're muted, darling.
Whoops. I can say I don't think that there's been real restrictions. I think that sorry. I think that, I think Barbados has generally good connection wirelessly. So I don't think that too many people were struggling. And again, as Dudrina said, it wasn't like it was an extended period of time, like an overly extended period of time. So it wasn't really that problematic. Again, I think in terms of connecting, I think it was more about having private conversations out loud within the spaces that they are was more the issue than not being able to have them generally. So yeah. You're muted as well now.
Thank you so much. That was a great answer, both of you, and a really good question. Great question, David. Thank you so much for that. As we're closing off, I'm not seeing any more questions.
I see Randy Warner has his hand.
Oh, really? I don't see that. Anyway, Latoya, can you unmute him? Or he can unmute himself?
Hi,
Go
good
ahead,
afternoon,
Randy.
colleagues.
Yes.
So
Thanks,
thank
Randy.
you again. Yeah, thank you again for having this discussion. Moni, Michael, great work. Deidre, is nice to meet you for the first time virtually. Uh, two slight interjections, particularly to David's comment about telecommunications and its impact. Um, from what I've seen, maybe not necessarily in Barbados, but I know, for example, in Dominica, those countries that were previously affected by natural disasters, especially in the rural areas where the telecommunications infrastructure is still under repair, it is not what it used to be. There has been some challenges getting COVID-19 communication to those people. Are they accessing certain services? And these are particularly vulnerable groups of which the LGBTQA groups would be part of. The other part of it would be with many of the entrenchments and the increase in unemployment, believe it or not, some persons are no longer able to pay for internet services. Hence why some of the programs for social protection have to be scaled up. Some of them have to be expanded, especially for those countries who were already previously still building up from having experienced natural disasters. This is Dominica, this is Antigua and Barbuda. So maybe from that lens, I could say that there has been somewhat of an impact, you know. The only other thing I wanted to add uh was basically to commend the conversation that was ongoing. because I think, and just so that everyone is aware, I work with the humanitarian affairs part of the UN, which is based in the Office of the Resident Coordinator for Barbados and the OECS. And it's important to kind of have these conversations because we need to know what the needs are. And one of the challenges that many of you know in this field is that one is that there's a lack of information, and then if you do have information, the challenge is finding a way to report and have the information in a systematic way that it's available, because this information is what kind of feeds into how agencies and partners respond to the needs of persons. So for example, we're working on a multi-sectoral response plan to COVID. It was launched earlier this year, and we're going to have an expansion of it because the needs have changed and evolved uh, as a result of COVID. It's shifted. And one of the things that is important is that in any of these funding appeals or these programs, we need to know what the needs of the vulnerable groups are. And even in preparing these documentations or trying to analyze the needs, it's hard to find the information, or at least documented. Sometimes it has to be through these channels, having these kind of conversations that I could jottle down a note and said, okay, you know, this particular community is affected this particular way. Let's make sure that they're also included, but also to on our part to make sure that CSOs are included in the conversation, finding a way to rope them in. So just a heads up for Monique and Michael. We're going to be hopefully reaching out to you later this week, to ensure that you can at least glance at the funding appeal document, because it is important that everybody is kind of reflected in it. The idea is to leave no one behind. So I just wanted to add that small interjection. Thank you.
Thank you, Randy. That was a really good interjection there, and I really appreciate that. Dejina started out by saying that she did not have a survey, but Dejina, I think we have to maybe reframe or decolonize the way we think about data collection, right? And I am very big on lived testimonies. I'm very big on anecdotes. These things count. These things are what actually Randy is looking for and creates substance and justification for projects and for funding. So, these anecdotes, these stories, these testimonies, these tales, these are critical. This is what we were looking for, especially with this discussion series on shock. And then just to add, Randy, last week, your former colleague at UNFPA, Denise Shivans Vogel, she spoke last week from the sub-regional perspective of the Caribbean. And, when she shared about the experiences of the different communities, at the different levels, I'm like, well, where is this information being captured? This needs to be documented. And just such rich information that we need to hear, because I'm a big oral history supporter, the oral histories of COVID and what people experienced and what they went through. So I think I think we need to really capture and value these experiences. And this is where the CSOs become very vital and very, very critical. So I think this, Randy? Or who was talking?
Me,
Sorry. Oh, Dejina,
I
yes.
said we didn't. Let me just be quite frank, Moni, with this. I said we didn't conduct a survey, but there's a survey being done by the National HIV/AIDS Commission, which I am managing for them, which captures 6 questions on COVID. However, I don't know if the other researchers would agree with me, because from the space of time March to this time where you're freer, less restriction and such, like, somehow when we're asking those 6 questions, if you have to get into the person's head and saying, back in this time, how did this feel? Because if we're talking COVID within March and we're talking COVID now in November, it is a great difference
Yeah.
between that time within that. But what I'm saying, what we are is actually a needs assessment we are doing to find out what are the needs of persons. I'm saying it was done in 2013. Now it's being repeated. We start in this year. Yeah, we start this year. And it's being done through technology where you interview the person based on phone. However, I'm saying in light of that, personally, me, when COVID first started, I was not one for, surveying people over and over so quick, because I'm saying it is new. Information is new. And if you go back to them in such a short space of time, it will change so drastically. And as I turn and tell you, reiterating what I'm saying, it is like when we have to do this now, it is hard to get true and good answers out to people, because you're asking a COVID question now in November, where they are, more freedom and such like. So that is just personally me. But I think it helps to share the information, anecdotes, and all these kind of things. I think that really helps.
Yeah, thanks a lot, Dadrina, for that. And I think this is where we need to maybe combine methodologies, the benefits of both, really quantitative, and for me, qualitative, really gets to probe those questions. But that's another conversation maybe we can think about for next semester, looking at data collection and evidence-based information, and how we go about collecting this information, and whose voice is privileged, even in these instruments that we're talking about in the surveys, right? So I think as we close off now, because we are over time, I just wanted, if there are no other comments or questions that I'm not seeing, I don't know if Latoya can see. Last two comments from Michael and Dadrina in maybe 30 seconds each. What would be your one call for action, knowing what you know now, lessons learned from this experience? If we had to shut down again, right, what would your call to action be for, let's say, the government of Barbados? Each of you, 30 seconds or less. One call.
Michael came up.
I'm here.
Yeah.
I'm not really sure. I think if we were to shut down again, I think that there's not as much resources now as there were then, but I think that we need to definitely mobilize. We would need to mobilize and ensure that persons have the essentials that they need to survive. I think though that we're in a better position to do that, having established certain systems before. So I think just being able to mobilize quickly and respond quickly would be something that we need, but we'll be able to do it more easily now because we have that experience.
Yeah. Thanks, Michael. And Dee?
What I would say to the government of Barbados is continued partnerships, meaningful engagement and dialogue, you understand me? And also I would say unity, because we continue to unify, because at the end of the day, it is just across Barbados that we have been hit by, this the COVID-19, and there are people with different thoughts about it. And I say we need to unify and continue to partner and dialogue with each other about this, and collaborate also, because collaboration is important. I might not be able to financially support your cause. However, I might be able to help your cause in a different way. And that's what we have to need to continue these good working relationships and work together for the better of our citizens. And as well, when we look at it, the Caribbean, and by further extent, the world.
Great answer, both of you. And I just want to now thank Dadrina and Michael for sharing with us today and giving us really a unique perspective that we're not hearing enough about in the region, as far as I'm concerned, and from where I sit, to hear from the KPOPs and marginalized communities. Thank you so much for sharing. Thanks also to Ms. Latoya, who is serving as technical producer today. Thank you so much. And thanks to our participants who joined us today. And of course to David, all the way from Canada. And just maybe look out for our next week and the week after. We have our final two. We'll be focusing on 16 days of activism against gender-based violence next week, and then our World AIDS Day webinars. So you can look out for our flyers, and remember to fill out the evaluation form that Keely will send to you a little later, maybe this evening or tonight, so that you can also tell us what topics you might be interested in. And thanks again, everyone. And hopefully we get to see you again soon. Take care. Oh, and also look out for, we will be posting the videos on our social media platform. So in case you weren't able to get everything, you can see them on our Instagram, Facebook, and YouTube channel. Thanks,
Yeah.
everyone. Take
Survey.
care.
Yeah.
Okay, bye-bye.